I'm coming to Life Chiropractic for about a year and a half now, and I've noticed a big change from the day I first started coming here, for sure. I play competitive squash. I've been playing since about 10 years old, and basically it's a pretty tough sport in the body, and I like to play a lot pretty much every day. So over time, basically I was just getting pain in my lower back just from the game itself, just the movements that are made. So I decided to come here and try something new.
I had an accident and fell in a swamp and fractured a couple of vertebrae.
I've been coming here about 5 or 6 years, and yeah, it's worked out very well for me. It's eased a lot of back pain first through injuries and from arthritis also. I had a hard time walking, I had a hard time standing up straight. A lot of the major joints ached, and it was all downstream from back injury.
I graduated chiropractic school in June of 1999. This combines my interest with people, anatomy, physiology, the need to help people, everything. It was a good fit from the very beginning. I think our practice is a little different in that we're really patient-focused. Everyone who comes in, we know them by name. It's a very nice community, and we do care. In terms of the techniques that we use here, I often tell people I do the whatever it takes technique, and I say that because I'm trained in 8 different techniques, and as a result, when patients come in, I tend to fit the technique to the patient, not the patient to the technique. When a new patient comes to our office, the very first thing we do is we want to learn about them. So we sit down and we have a thorough history to really discover what's going on and what's brought them here. The second aspect of their first visit is we do a thorough examination to determine if we can help them, and also to figure out what's causing their problem, how serious is it. After that, some patients will go through x-rays, and the purpose of the x-ray is to learn structurally what's prevented them from healing, but much more importantly, how to correct it, because that's what x-rays really help us with. Once the x-rays are processed, or after the examination, we'll bring patients back in and we go through what's called a report of findings, where we sit down with them, explain the results of the exam, and we talk about how exactly we're going to help them. Most of our patients, we work with them using chiropractic techniques. For the more serious cases, we do have a spinal decompression machine, so people that are trying to avoid surgery, people that are just haven't gotten the results that they've been looking for using manual therapy, spinal decompression often is that little extra that helps them get well.
Yeah, he's just gradually straightened me out and got things in order, and today is a very good day. I don't feel literally any pain at all. I can stand up straight, stand tall, and feel tall.
Oh, I feel a lot better, and I can walk without my cane. When I started, I was in a walker, but now I can walk with a cane, and in a small place like this, I can walk without a cane. But the big thing is I can stand up straight.
Basically, it's allowed me, my squash game has improved quite a bit just because it's allowed me to train harder. By loosening my back, like I said, it's given me more ability to push harder day in and day out. And just recovery time, I don't have to take days off after a hard workout. So it's really allowed me just to be more consistent with my training, and then that's translated into a better shape on court. And
I just love people. I love working with people, and it's a good fit for me, and yeah, it's a great exchange. Yeah.
I've referred a couple of friends to Dr. Zybutz, and I've told them, I know a lot of people through squash, and I explained to all of them, anyone who has a back problem, to definitely check him out. And I gave it a try, and it's made a world of difference for me.
Sons and grandsons come here, and lots of friends come here too. It's quite, yeah, there's a lot of them.